So I think the more these anti-obesity meds become prevalent and the more people take them, you're gonna see fewer joint replacements. So check back 10, 20 years, see if I'm right. Okay, in 2022, there were 766,000 total hip replacements, which is a 3.8% increase from 2021. 2000 to 2010, the rate had doubled, okay? And in 2025, it's expected to be about 652,000 a year. Again, about a 2.3% chance if you're 50, some doctor's gonna tell you you need a total joint replacement, a hip in this case. 30% of these are now being done in people under 55. Now that would have been unheard of when I was training as a resident. Nobody would have thought of putting a total joint in somebody in that age group. Now we routinely put it in people in their 30s and 40s. So we're doing more of them because maybe our scope of indications has increased. We used to limit it to over 60 or over 65. Now we're saying, oh no, you're 40, we can put a total joint in you. So that effectively expands the market for total joints. And I think that's one of the reasons you're seeing more and more of these. So again, the common narrative is it's wear and tear. I think most of it is the fundamental issues that I always talk about, that the well theory is built around, which is chronic inflammation, oxidative stress, mitochondrial dysfunction, and insulin resistance. But everybody always still says wear and tear, that you're too active, that you overused it, yada, yada. But more and more physicians are starting to recognize that obesity may play into this. However, most physicians still think obesity matters because it's more load or heavier weight put on the knee. What obesity is really doing is it's constantly producing inflammation. So your adipose tissue is a factory that never shuts down, and that factory makes pro-inflammatory cytokines or proteins. And so your fat cells are attacking you all day long without rest. And your body is always having to fight back, which in most cases doesn't have the building blocks it needs to fight back. So the dramatic increase, this is a title of the article I wanted to highlight. The dramatic increase in total knee replacement utilization rates in the US cannot be fully explained by the growth in population size and the obesity epidemic. So people are looking at this very closely. Is it wear and tear? Probably not. Is it obesity? Probably, but maybe not fully. So all we know is there's been a dramatic increase in rates. I think part of the problem too is the indication creep. So in other words, it's no longer just 65 with end-stage arthritis. Now it's 55, now it's 50, now it's 40. Earlier and earlier stages of arthritis. And I'm going to show you some more information a little bit later that shows you how switching what the payers will do also has increased the rates of total joints. So Stryker, which is one of the biggest American companies that makes these implants, their global sales of total knee arthroplasty in 2023 was $2.2 billion. In Q1 of 2024, they had revenue of $588 million, and the profits were estimated at $359 million. So this is a very profitable business for the companies that make the implants. Not really for the doctors, kind of for the hospitals, but really for the companies that make the implants. Younger patients now, so obviously you want to expand your market share, right? So now we're indicating younger and younger patients, and we're saying it's because they're more active. But I already told you that the United States has the least active people in the world, yet we have the highest incidence of arthritis. So that doesn't really make sense.